Last week, we talked about why your voice takes longer to heal than you feel like you do. That frustrating 1 to 3 week gap between feeling better and your vocal folds actually being ready again. But knowing the science doesn't answer the question you're really asking. Okay, but when can I sing again? And how do I get back safely? That's what this episode's for. A specific phase-by-phase protocol for returning to singing after a cold. How to test your readiness. What exercises to start with. And, because I know this matters, what to do when you absolutely have to perform before you're fully recovered. To recap in one sentence, your vocal folds need 1 to 3 weeks longer than the rest of you to recover from a respiratory infection. Today, we're navigating that window. We'll cover 4 things: how to test if you're ready, a 4-phase return protocol, how to handle that persistent lump in the throat feeling, and what to do when you have to perform anyway. Let's get into it. Quick note before we dive in. I'm not a doctor. Nothing in this episode is medical advice. If you're dealing with persistent symptoms, pain, or anything that concerns you, please see a professional. What I'm sharing here is what the voice science literature says, but your doctor knows your specific situation. The Readiness Assessment. Before you start singing again, you need information. Not permission from a calendar, actual feedback from your voice. These 3 tests give you that. Test 1, the Happy Birthday Test. Sing the first line of Happy Birthday very softly. Start at a comfortable pitch, then repeat it at progressively higher pitches. What you're listening for? Sluggishness. That feeling that the voice is lagging behind your intention, like you're pushing through mud to get the sound started. If the voice feels sluggish or delayed compared to your normal, you may still have residual swelling. Continue resting. If the voice responds the way it usually does, immediate, easy engagement, move on to the next test. Test 2. High soft singing. Try singing softly in your upper range. Not belting, not pushing, soft. This is the earliest indicator of trouble. If you can't do this easily, if it feels like pushing through resistance, or if the voice breaks, you're not ready. Why? Swollen folds require greater subglottic pressure to vibrate at higher frequencies. The swelling makes them heavier and stiffer. Soft high singing exposes that immediately. Test 3. The 20 to 30 minute range check. Can you explore your full range for 20 to 30 minutes without excess difficulty? Pay attention to the low notes especially. They often feel thick or unresponsive when swelling is present. If you can move through your range for that duration without the voice fatiguing or feeling effortful, your folds have typically stopped swelling. This usually happens 3 to 4 days after the initial onset of laryngitis. Now, these aren't pass or fail tests. They're information. If you're not ready today, test again tomorrow. The voice will tell you when it's time. You just have to ask the right questions. The 4-phase return protocol. Once you know where you stand, you need a systematic path back. This protocol matches your activity level to your tissue's actual state of healing. Phase 1. Acute illness, days 1 to 7 of symptoms. What to do? Complete voice rest, or speak only at low volume, like you're telling someone a secret. Important. This is not whispering. Whispering actually increases laryngeal tension. Normal phonation at low volume is better. Avoid noisy environments that force you to speak up. Arm's length conversation, volume maximum. Why it matters. Voice rest is the single most important factor in recovery. This is when your vocal folds are most fragile. the tissue's inflamed, the blood vessels are engorged and fragile, and even normal talking can traumatize the tissue. Duration. Continue until your cold symptoms resolve. Then you move to Phase 2. Phase 2. Post-Symptom Resolution. Days 3 to 7 after symptoms resolve. What to do? Continue relative voice rest in speaking. Begin gentle humming exercises on M, N, and ng sounds. Introduce SOVTEs, lip trills, tongue trills, and the duration? 3 to 5 minutes, once or twice daily. Stop if voice fatigues quickly or feels effortful. Specific protocol. Hum on a comfortable pitch for 30 seconds. Rest 30 seconds, then repeat 3 to 5 times. If that feels easy and effortless, add gentle pitch glides on lip trills. Never push into discomfort. Why it matters? Recent research challenges prolonged complete rest. A study by Kaneko et al. Found that 3 days of voice rest, plus early gentle exercise, actually produced better wound healing than 7 days of rest alone. SOVTEs can be used to create back pressure that can gently stretch recovering tissue without as much impact stress. You're ready for Phase 3 when humming and SOVTEs feel easy. Your speaking voice has normalized, and you pass all 3 readiness tests. Phase 3. Graduated return. Weeks 2 to 3 post-symptom resolution. What to do? Begin singing at reduced intensity, 50 to 60% of your normal effort. Focus on your comfortable middle range. Then, gradually expand outward. Extend your duration gradually, 10 minutes to 15 minutes, then to 20 minutes, over several days. Some warning signs to stop. Your voice fatigues faster than expected. High, soft singing becomes difficult again. Hoarseness develops during or after practice. If any of these happen, return to Phase 2 for another few days. Your tissue needs more time. Phase 4. Return to performance criteria. You're ready for full performance when all of these are true. Full range accessible without excess effort. High, soft singing feels normal for you. No unusual breaks or changes from your baseline. Voice sustains through moderate use, about 30 or so minutes, without unusual fatigue. No hoarseness in speaking voice, and no persistent lump in throat sensation affecting your technique. You should hit all 5 of these. Not 4 out of 5, all 5. For professional voice users, if symptoms persisted beyond 2 weeks, laryngologists recommend stroboscopic evaluation before resuming performance. If you have access to a voice specialist, use them. They can see things you can't feel. Let's talk about that persistent lump in the throat feeling that sometimes lingers long after your cold is gone. What it is. The sensation of something stuck in your throat, even when nothing's there, it affects up to about 46% of the population at some point and accounts for 4% of all ENT referrals. It's extremely common. Why it persists after a cold. 3 mechanisms, often overlapping. First, post-nasal drip creates a direct sensation of fullness at the back of your throat. Second, all that coughing during illness can trigger or worsen laryngopharyngeal reflux, acid irritation that perpetuates the sensation. Third, cricopharyngeal muscle tension. The upper esophageal sphincter can develop elevated resting tension. Studies show 28% of patients with this sensation have measurably higher sphincter pressure compared to 3% of controls. The reassuring data? A long-term study following patients for over 7 years found that 55% became completely asymptomatic. No patient in the study developed malignancy. This sensation typically resolves within 2 to 3 weeks after an upper respiratory infection. Practical strategies. Substitute swallowing for throat clearing. A hard swallow sweeps mucus away without traumatizing the folds. Every time you feel the urge to clear, swallow hard instead. Sip chilled carbonated water when the urge to clear arises. The carbonation seems to help. It provides sensory feedback that interrupts the clearing reflex. Circumlaryngeal massage. Gentle external massage around the larynx can release tension in the surrounding musculature. Work with a voice therapist to learn the technique. Diaphragmatic breathing. This reduces overall tension in the region. 5 to 10 slow breaths, focusing on belly expansion, can reset the symptom. When to seek help. If this sensation persists beyond 2 to 3 weeks post-illness, get evaluated. It usually resolves on its own, but persistent symptoms warrant a look to rule out other causes. Breaking the cough and throat clearing cycle. This one is sneaky because the habit can persist long after the illness is gone. During coughing, your vocal folds slam together with significant force. This creates a self-perpetuating cycle. Inflammation triggers coughing. Coughing causes more inflammation, which triggers more coughing. Even after your cold resolves, the habit can persist. You're not actually clearing anything anymore. You're just traumatizing tissue out of reflex. The clinical reality? Silent cough and soft throat clear are less harmful than full force clearing, but they don't actually move mucus effectively. The trade-off is acceptable. Protecting vulnerable recovering tissue matters more than clearing every bit of mucus. Practical interventions. Hard swallow instead of clearing. First choice every time. The swallow action sweeps the throat without impact. Sip water while swallowing. This adds lubrication and makes the swallow more effective. Honey. This acts as a demulcent. It coats and soothes. It doesn't touch your vocal folds directly, your epiglottis prevents that, but it reduces the cough urge that leads to traumatic coughing. Guaifenesin, that's Mucinex, plain formula. Thins mucus so it triggers the clearing reflex less often. Avoid versions with D or DM, those add ingredients that work against you. Stay hydrated systemically. Same goal. Thinner mucus, less urge to clear. Consistent hydration throughout the day, not just before singing. The habit takes conscious effort to break. Every time you catch yourself about to clear, pause and swallow instead. It feels unsatisfying at first, but do it anyway. When performance is unavoidable. Look, I'm not going to pretend that this is ideal. Sometimes professional obligations make canceling impossible. If you must perform while recovering, here's how to minimize damage. The decision framework. Proceed with caution when symptoms are in the head, nasal congestion, sinus pressure, no throat involvement, no hoarseness or voice change, there's no fever, voice fatigues but recovers with rest. Cancel when any significant hoarseness or voice change. Fever indicates systemic illness, not just local. Pain on swallowing. Sudden voice change. Possible hemorrhage, and this is a voice emergency. Productive cough, chest involvement. Symptoms have moved to the throat. If you're in the cancel category, cancel. I know that's not what you want to hear, but performing through those conditions risks damage that takes months to repair, not weeks. If you're in the proceed with caution category, talk to a doctor first if you can. They can assess whether you're actually ready or just hopeful. And if something goes wrong during the performance, you'll want that professional input on record. Pre-performance protocol. Hydration is everything. Increase your intake 25 to 50% above normal in the 24 hours leading up to performance. Systemic hydration takes time to reach vocal fold tissue. Drinking water backstage is too late. You should be hydrating significantly throughout your entire recovery anyway. But the day before and the day of a performance, push it even more. Steam or nebulized saline immediately before performance adds surface moisture. This complements systemic hydration, but it doesn't replace it. Repertoire modifications. Transpose to lower keys when possible. Your upper range is most affected. Select lighter repertoire. Avoid demanding coloratura or sustained high notes. In orchestral or operatic settings where transposition isn't possible, understudies should step in. Rely on breath support and core engagement, not throat-level compensation. When the voice isn't working normally, there's a temptation to squeeze and push at the larynx level. That makes everything worse. Focus on what you know works. Trust your established technique rather than inventing new strategies under pressure. Or simply put, don't change how you sing just because it feels different. After performance. Extend voice rest. Return to phase 2 protocols. Don't assume you're through it because you got through the show. The tissue paid a price. Give it time to recover. Let's bring this together. Test your readiness with the happy birthday test, high soft singing, and the 20 to 30 minute range check. Follow the 4 phases. Complete rest during acute illness. SOVTEs after symptoms resolve. Graduated return over weeks 2 and 3. Then, full return when you can meet all 5 criteria. Manage that lump in the throat feeling with swallowing and hydration, not clearing. And if you absolutely must perform, hydrate aggressively in the 24 hours before, modify your repertoire, and rely on your established technique. Here's what I want you to take away. You're not being dramatic when you need to rest your voice. You're not being a diva when you cancel. You're being smart. The singers who have long, healthy careers aren't the ones who push through everything. They're the ones who know when to protect their instrument. This protocol isn't about being cautious for caution's sake. It's about being strategic so you can keep singing for decades. Bosi Academy. The protocols we covered today work best when you have solid technique to return to. When you're recovering from illness and everything feels off, that technical foundation is what carries you through. Bosi Academy is built around developing that consistent foundation, technique you can trust even when your voice doesn't feel quite right. Link in the description. And as always, keep singing smart.